lost about 25 pounds, and since then that part was good, but I started to notice a little more sagging, wrinkles here, a lot of lines here and here. I mean, I'm going to be 52, but I'm starting to freak out. So I'd really like something natural, but kind of a little bit of a lift to remove some of the lines.
Right. She really doesn't have very much in terms of her forehead. This area and the glabella area, right in between the eyebrows, is where most women have their complaints. What we really do is just get rid of all of the makeup that you have. So we use alcohol to do that. What this also helps me to do is it also helps me to identify any blood vessels, so I can be sure to avoid that. What I do tend to tell people who do bruise frequently, there is a tablet that's called Arnica montanum. It also comes in the form of a cream. If you use that, it actually decreases the amount of bruising that you have. This can be sold in any homeopathic store. I tend to give this along with my PRP therapy patients that I do on the face, because it is such an extensive amount of sticks to the face. But this, certainly for any procedure, you can use this.
Can I put a little plug in for that? Because I got the PRP procedure done and I started taking that, and I also have a bulging disc in my back, so I started taking it actually as the instructions on there say, and my back is 98% better. And I ran out, so I wasn't taking it anymore, and my back, I'm on my feet all day long, so by the end of the day, after doing hair all day, my legs throb so much I can't sleep at night. I've used that and the pain is gone. It's amazing.
So raise your eyebrows for me. So what I do and how I decide what amount of product to give to someone is I essentially get you to make the facial expressions so I can actually visualize the muscles that I'm going to be injecting. So this is essentially the area that I will be injecting on her. Let's give it, see a frown. Great. And then the doctor will decide essentially, are you going to get a smaller amount or are you going to get a larger amount? And that depends on how much wrinkling you have and how when you make the facial expressions, how thick that muscle mass is. Men tend to need more. They make a lot of facial expressions and their muscles tend to be a lot stronger in general. Along with the fact that there's a spocking, which women hate because it basically is a telltale sign that you had Botox done, we also make sure that we inject outside certain landmark areas. And one of those landmark areas is we take a finger breadth above the eyebrow. And in essence, we don't weaken and deaden this muscle too much, because what can happen is you actually deaden this and you get like this angry look. This gets all pushed down. So for women who do get this area done, I always ask them to also consider, even though it is a little bit more money, to get this area done. So you get a balance of pushing this down, but you also lift this area. And this also creates a much more youthful look on the face. And the dosage for your glabella area for Xeomin is 8 units for the large muscle that's in the center and 2 units for the other muscles. That's at the lower end of the spectrum. And that's what we'll be using with her today. And for the physicians and the nurses in the audience who are also interested in doing this, we tend to use the lowest gauge needle that we possibly can. It's as small as an insulin syringe, and so that tends to be actually really low in terms of discomfort for what we're going to do. And this is our technique. This is how we hold the syringe when we're doing Botox and when we're doing dermal fillers. And it gives you a lot more control over the procedure. So that's our first PRP run. We're going to let it stop, and then we're going to let it spin for a second. All right, so I'm going to get some sticks so you relax. You feel okay?
Mm-hmm.
Okay. She's not bruising. But certainly, what I would do if someone told me they had a history of bruising is that I'd make sure that they had arnica before, because there can be bruising associated with this procedure. Usually, my patients that I see first, unless they know for sure how many units do help them to relax, I tend to give what's on the lower side of the spectrum, so that I don't overtreat, I don't make the person look like all surprised. Face is a very vascular area, so you may see a lot of bleeding. To prevent the bruising, or decrease the bruising rather, it's just best just to keep some pressure on the area until they stop. And they usually stop pretty quickly. And so just so I don't ever go below that line, what I do is I just put my finger on the eyebrow so I can actually see that landmark that I'm trying to achieve. Feel okay?
Mm-hmm.
All right. And you'll see that there's a bit of like lumpiness that's there to the face that gets dissipated really quite quickly. Okay. Make a right. And the technique for this is just to really grab that belly of the muscle. Some doctors will just put like one stick of the injection of the medication in. What I like to do is to get the medication at the top of the muscle and at the bottom of the muscle to make sure that the entire muscle gets the benefit. Stick. The difference between Xeomin, which is what I'm using today, and Botox is really that Botox comes with some proteins which really don't do nothing. They just basically provide the vehicle for which the medication is administered into your body. What Xeomin has been able to do is to purify the protein that we use to relax these muscles, and to do it without additional proteins in it. So it's a much lighter product. They do the same thing, it just is a difference. For that reason, what some clients have noted with Xeomin is that the onset of action is before. Botox tends to take about 5 days to see the result. Xeomin tends to take maybe 2 days before that, and then there's another product called Dysport that tends to even come with onset a little bit less rather. So in about 2 to 3 days with Dysport, you'll see the results. One more stick. Now, so I've basically done all the stuff that she has been concerned about in this area. What some women tend to like, most women do like having a bit of a lift in the eyebrows. It's great for our makeup. And is that something you're interested in at all?
Sure.
To have that get lifted?
Yeah. Take 10 years, baby, if you can. 5's good, 10's better.
Right. And so for the people who are interested in the audience who are interested in this, we tend to not like kind of put what we think would look nice, because what we think would look nice is not necessarily something that the client will think looks nice. Some people are actually quite happy with some of their quirks, and so that's fine. That tends to give them character, and that tends to be what makes them them. So I just tend to ask if that's something that they've thought about, something that they think they'd like, or if they want to try that. And so we'll try that.
Yeah.
All right, so I'm going to give you a little bit of lift here. And this is the area actually that we tend to get a lot of spocking. I'll just make sure that I balance that off in your forehead so you don't get that look. So I'm going to do 2 in your forehead just to balance off those 2 areas, and then we'll do the eyes. So let's have you squint, and always remember to keep your finger on that orbit bone. And again, this is for those of us who are interested in going into this field. We keep the direction of the needle away from the eyes. How's that? Okay?
Yeah.
All right, turn towards me. Squint again. Right, just here. And you want to keep it symmetrical. So we did 5 sticks. We essentially going to do 5 sticks on this side as well. Stick. Okay? I have a little tiny bit more if you want. There are some lines right here by the nose, like right here and right here. We call them bunny lines. Do you want me to do those?
Sure.
Okay.
All right. Enough other quirks. I don't need them on my face.
So some women get lines like around the nose. That's actually something that we can use Botox or Xeomin or Dysport for. A lot of people don't know that. And that will just relax all of those lines. I think they actually look cute, but some people don't like them. And if you have them, then we can use it for that. Let me just wipe you off. And we just essentially just inject the muscle on both of these sides. Again, you just keep your finger to prevent any medication from going in the eye. You may have a little bruising here actually with this one. So I'll give you some arnica and you can take that to decrease the bruising. And I'll give you some cream. Other things that we can use this for, Botox I think has been in the news. We can use this for migraines. You basically inject the muscles where your migraines originating from, and you can use it for that. I don't think the Dysport and the Xeomin has those indications just yet. There are other off-label uses that you can use this stuff for. Sometimes people have like really gummy smiles. They smile and then all their gums show. You can use that to kind of relax those muscles that pull the lip up a bit too much. We can also use it as well for, there is this muscle here, there's some dimpling that's there. I could do that for you too if you want.
Sure.
Okay. And what that does, I don't know if people can appreciate that, but sometimes there's some people who they smile and this muscle gets really wrinkled and dimpled. And as you get older, because this muscle becomes so pronounced, it kind of lifts up like this and you get like this kind of ball right there. So we can inject the muscle there and that will just like kind of pull everything down. So I'll give you a little here since you're here. And so I'm basically doing this so that you guys can all see all the different uses really that we have for Botox. And since she's game for like a lot of this stuff, then
Good model. You can do it.
then fine. But you'll really see a difference. Does everybody understand like what I'm talking about with that dimple? With the woman do? Okay, fine. There's a little crease that happens there. And we can just relax that. And there's a dosage for that too. So all these different muscles, the companies actually have looked at it and they've actually measured out how much. 448. How much medication should be used for those? You okay? You're not bored? Good. All right. So here we go. And for the people who are interested, this actually is a musk that has two bellies. There's one belly that goes to here, and there's one the belly that goes to here. And so we inject that. Stick. Stick. For the dermal fillers, we're going to be using this product called Radiesse. Okay, and Radiesse is really kind of like a device. Most of our dermal fillers that we use, they actually have hyaluronic acid. That's the common denominator with all of them. What Radiesse has also done is they put in a little calcium hydroxyapatite, and that makes this product much more substantive. And so if you have an area that really needs filling, you're going to see some really good effects with Radiesse. So she's been cooking with some lidocaine. We also have lidocaine already instilled in this. How was that? Not bad. Good. And you can basically see this kind of filling out already. What we then do is we go within the mouth and we mold it to get the form that we want it to get. So because this has a little more calcium in it, you actually will appreciate this product and be able to feel it on the inside. What the hyaluronic acid does is what it essentially does in your body is it kind of recruits a lot of water into the area. And this will continue to have like a softened appearance over the next 9 months. All right, we do the same thing on this side.
Oh no, sorry.
Stick.
How does that feel?
All right, I'm gonna go back in the mouth. And we just mold that. Now the same company also has a product by the name of Bellatero, which for really fine lines and for the lips does wonders. We can't put Radiesse in the lips because it has calcium in it. And so that would kind of harden in your lips. We don't use Radiesse in the lips, but there is a product by the name of Bellatero, which I've been really impressed with. Very natural and really makes fine lines almost literally disappear.
Stick. Smooth that out. Okay.
I think the gauze is even actually too rough for your skin. That's why I'm using just my hand. So I've softened it a little bit. This is an area. It's a very dynamic area that she has this line, but I've certainly softened it quite a bit. It's not as deep as it was before. So I'm gonna put a little bit more just to get it to pop out a little bit more. Okay. What do you guys think? We basically did some zoom into the forehead. We did some zoom in for these areas. We did Radiesse for the nasolabial folds.
Yeah, it did go.
Yeah, yeah. So you'll stop being red like in about 24 to 48 hours. You're gonna take. Did I give you some arnica tablets?
Yes.
You get some arnica tablets. Get rid of some of this bruising. Because I can see here, and that around the eyes are really, you have a lot of blood vessels that are really superficial. I can see that you're gonna have a little bruising there. But in 2 days, you're gonna see that completely relaxed, and I haven't given you too much product, so you should still get quite a bit of eye movement. Again, which is another telltale with having this procedure done that you don't want. You don't want to have like a face that can't move. So we keep things natural.